I think what's become obvious to us working on ISS currently is the relationship between research and operations being more closely tied, in that on the operational side, we can only do so much to observe and react to what's going on. And the research side is supposed to be helping us understand the mechanism, which could target countermeasures or prevention much more effectively. So if the two groups work closely together, you probably have a better chance of transitioning what comes out of the research world to operations more quickly, in that we wouldn't have to redesign or rebuild whatever was used on the research side to actually do the implementation on the operations side. It would be incumbent upon the research and operational community to do that joint development, so that in the end you had an operationally implementable product for the ground crew or the flight crew to use. A good example of the two communities working together is currently the Visual Impairment and Intracranial Pressure Project. We have several joint forums where both communities sit at the same table and discuss what they're doing currently, what results are they finding out, how are they comparable. The research community smartly made the choice to actually mirror the medical requirement, but they take the data more frequently, and they actually add a variety of other tests to those data takes so that the operational community can see what they're going to get out of it in almost real-time fashion. And we can also make the decision if something isn't producing results that are meaningful, that we can stop doing it and move on to other things. So it allows actually the research community to be more flexible and responsive to the operational community's needs.
In the arena of operational and clinical synergy, it's very important for us for future endeavors to make sure that we're working that issue very carefully. For an example, we'll talk about the EVA pre-brief protocols that were necessary to be developed to help us build International Space Station. It was important to develop appropriate pre-brief protocols as we entered into a higher number of EVAs to help mitigate any risk of decompression sickness. Nitrogen in your body has the potential to coalesce and cause various symptoms. In order to unload that nitrogen from your system, we use various pre-brief protocols. Those often include some exercise on an oxygen mask and other durations of oxygen breathing to help reduce that risk. As we try to maximize these research opportunities, we don't have unlimited resources. So we brought together flight surgeons, physiologists, flight directors, crew members, folks from the commercial diving world, military experts, and looked at how do we most efficiently design a protocol that we can implement on orbit, be friendly to the crew members, and also within the constraints of time, allow us to prepare a crew member to go out the door for an EVA. And this is an example of why it's imperative that the research side of the house understands elements of engineering and vice versa. The engineers understand the human aspect so we can move ahead and solve technical problems such as this.